Welcome. I hope everyone is having a great Thursday. A very warm welcome to everyone that is watching today's live stream. I'm so happy that you're here. Today, we're going to be talking about you have a desire to get into teaching OT or PT students, but are unsure where to begin. And I'm going to be going over the basics of where to get started and how to get your foot in the door of academics. I'd like to start by introducing myself. I am Dr. Tim Miller, physical therapist and a mentor and coach to faculty members and clinicians who want to transition into teaching. I have worked, like I said, a physical therapist, started out my career in the clinic and really loved being involved with working with students, as a clinical instructor, and then got into doing some lab assisting. And then, I eventually found a position as a clinical faculty member at the University of South Florida, where I worked full-time in the clinic, worked with students, and got to do some teaching. And then from there, transitioned into a full-time faculty member at Nova Southeastern University's DPT program in Tampa. And I was there for 7 years as full-time faculty, going through the ranks, and then an opportunity came about for me to work doing faculty development, curricular development, faculty coaching, and those types of things in PT and OT, both post-professional and entry level, working with a group from Rehab Essentials. And it's just been a really good opportunity because I've gotten to do even more of I do still work with students, but I've gotten to expand into doing faculty development, faculty coaching, and those types of things. Um, what I'd like to do is if you're watching live, please type live in the comments and then tell me who you are and where you're from. So in the chat, you can tell me your name and where you're watching from. If you're watching the replay, please type replay and then tell me who you are and where you're from. Also drop in the comments if you are a current faculty member or applying to become a teacher in any capacity, or maybe just thinking about transitioning into academics. But I just really want to get started with just some tips of getting your foot in the door. So chances are you're here because at some point you've thought about teaching. You've had the itch for a while, but you've always had that pull to teach others. As a clinician, perhaps. I mean, we're always teaching. We're teaching with our we're teaching our patients, and perhaps you've had an opportunity to work with students as a clinical instructor. Teaching others is just something that you like, but oftentimes you may be feeling, with the clinical positions, frustrated or burnt out, or or even if you don't, you just kind of have always had that pull to do some teaching, and you've decided that you'd like to transition to academics, but you're not really sure where to start or steps to take. Um, so let's talk about the basics of how and where to get started. One thing that I hear a lot is clinicians that want to get in teaching, they say, well, I'm not qualified to teach or become faculty, and already count themselves out. Or even exploring teaching because they heard you have to have a PhD or an EDD just to even get your foot in the door, and not just a DPT or OTD. But please know that you are qualified to get your foot in the door of teaching, and it does not require one of those terminal academic degrees to start out with, which is I'm sure a big relief because oftentimes people are like, well, I want to get into teaching, but I don't want to go, and do a 4-year PhD, to do that. So again, you're in the right place because I can kind of help talk you through how that looks and how that works. So um, I'm going to start with just sharing one of the best places to start is to be a lab assistant for a local PT or OT program. Most programs don't have enough full-time faculty to cover, the instructor to student ratio that's required. And it's also really beneficial for programs to have local clinicians who are currently working in the clinic to help facilitate, teaching and learning the concepts covered in the classroom. And it might have been your experience when you were in PT or OT school that, a lot of your professors may have been removed pretty far from the clinic. I remember in PT school, we had some professors like, well, 20 years ago when I was in the clinic, things were, like this. So it's always nice to have someone who was like, this morning in the clinic, this is what I saw and this is how I, took care of it. So again, having local clinicians help lab instructing and grading, skills check and practicals is mutually beneficial to the program and to the students. It's also a really nice way to get introduced to academics without having the responsibility of being in charge of an entire class and all that entails. So typically lab assistant type positions, you supervise students practicing, share your expertise, provide feedback, and then and then grade their performance on whatever skill it is that may be provided. So if that sounds great, where do you find those positions? I will say that often those positions are not advertised like on job sites or those types of things, but it's been my experience that those positions are typically filled just by word of mouth. So when I was full-time faculty and I needed lab assistants, we would, as a faculty, talk. I would also work PRN in clinics and get to know some clinicians. Say, hey, would you be interested in helping out in my class or those types of things? So again, with as many PT and OT programs that are in the U.S., chances are that you likely live close to a program. And even if you don't, and we can, if you have questions about this, I can also share, but there are some hybrid programs that even fly faculty in, lab assistants in to help fill those voids as well. So if you don't have a program nearby, don't count yourself out. But really the best way to get started, and I know it might sound a little bit too easy or simple, but is really just reach out to the director of the program. Every program has a website. They have to list their directors, their faculty, those types of things. So just reaching out and see if they have any, lab assistant opportunities or lab assisting opportunities. Because again, there's usually a need, but these needs aren't typically advertised in the sense of, hey, we have this position open, and they have like an applicant pool or those types of things. Because it works similar to kind of like a PRN position for a clinician. So being a lab assistant is how I got started into teaching, and several of my former lab assistants that I've mentored have transitioned into full-time faculty positions. So this is a perfect way to get your foot in the door to gain teaching experience and some time with in the world of academics. Um, Often the question comes up, well, what does that pay? Usually it's a typical clinician PRN rate, for coming in, and so hourly PRN. Some universities, it's a 1099 position. Others, you may be like fully onboarded in a temporary position, or those types of things. So again, it's just a really nice way to get involved, to establish relationship with people in the program, and those types of things. And as a lab assistant, oftentimes, if other positions open up within the program, the applicant pool tends to come from lab assistants who are familiar with the program, and those types of things. So that's one way. That is how I got started. It's a way that I know a lot of full-time faculty now who I have, coached and mentored, got started, and then, transitioned into a full-time faculty position. In addition to lab assisting, there are sometimes opportunities to be a guest lecturer or even adjunct faculty, which I'm sure are terms that you may have heard. But let's first talk about guest lecturing. So in a program, PT or OT, faculty or the program might use guest lecturers to help share specific areas of expertise for the course that a faculty member that's in charge of the course may not have. So you're often asked to provide a lecture or lectures on a topic, and sometimes create some type of assessment activities around that topic. This option is also great for clinicians, or is great for clinicians who have some type of specialization or specific area expertise. So, example off the top of my head might be like vestibular rehab. Like say you run a clinic of vestibular rehab, there might be a faculty member in their neuro curriculum who don't have that clinical expertise in it, and so they want to bring in a guest lecturer or those types of things. So just like lab assisting, these opportunities are also often not advertised in the sense of being on like job boards or those types of things. So the best way to define them, and I know I just mentioned this, was developing a relationship with faculty and program directors, usually by lab assisting as well, or even just contact the program director, directly and say, hey, I have, do you have any needs in your curriculum for some guest lecturing? I have this area of expertise that I would love the opportunity to share, or whatever that may be. So again, often these positions just take, or getting involved in these positions just take some initiative in terms of finding a program maybe that might be nearby, and reaching out to the director and just saying, hey, what opportunities do you have to get involved with lab assisting or guest lecturing or those types of things. Separate from guest lecturing, you might have heard the term adjunct faculty. So these positions are essentially part-time faculty teaching positions, and it's typically where the adjunct is in charge of, or being the faculty of record of an entire course. So if we think of lab assisting, you're kind of coming in and helping out with labs. Guest lecturer sometimes might be called guest lecturer / adjunct, but a official adjunct, I would say, or my experience with universities who use adjuncts, it's okay, we have a course that we just don't have assigned, or we don't have enough full-time faculty to have this course assigned to, so we want to assign it to an adjunct, where you're in charge of the entire course, so building and delivering the content, creating the graded or the assessment activities, planning and running everything that goes into that course. So again, it's the one position out of lab assisting and guest lecturing that gives you experience that I think that's closest to being a full-time faculty, because you are the boss of that course, and you have to create it, and all of the the challenges, and not that to say that challenges are bad, but the things that come with that in terms of managing the students, managing the course, and that type of thing. So these positions are more likely to be advertised than the other two, but not always. So just like lab assisting and being a guest lecturer, establishing, establishing, there's the word, a relationship with the program is a good way to find out about these, positions, opportunities. So one example that, that would often happen is, let's say a faculty member resigns, and just academic positions can take months and months to fill. It's not like a, clinical position where all of a sudden, you can fill it the next day. But the program and the curriculum just don't stop because this person is left. So often program directors ask faculty and lab assistants maybe if they know anyone who could teach blank course that's coming up. A lot of times, it may just be word of mouth, or they're trying to fill a gap because, let's say it happens right now, it's June, and they have, or, whatever month, and in 2 months they have this course coming up and they don't have anybody to teach it. So again, it may not be advertised. Sometimes they might be, but often getting your foot in the door is just helpful, of just having that relationship with a program, or being familiar with the program director through, if you've done guest lecturing or lab assisting, or just reaching out, again, because it could just be, yeah, actually we have a we we have a need that we need to fill. Tell me about what you might be able to do. So a good question that comes up is, what does this pay? Typically, universities or programs have like a flat rate for teaching a course of X number of dollars for this number of credit hour course. It's not usually a lot. It may just be, okay, you get um, a certain number, several $1,000s for teaching that entire course the entire semester. One thing to be aware of as you're looking at these is, knowing, well, do you get paid to develop it, or is this just the rate to just to teach it, which includes all the development? So those are different, two different things. And oftentimes, the work on the front end of developing it, obviously is a lot of work. And so you just want to have some clarity in terms of, for adjunct, do you get compensated for the development and then compensated differently once you run the course, or just kind of how that looks? So that's just one tip that I would share. If you are looking at any of these positions or aware of them, just kind of understanding, how does this work? It might just be one flat rate for everything. And if you get asked to teach it again, the nice thing is you've already had it developed, and you may just need to do some edits the second time around. So, again, it's not usually a ton of money where you can just, fully quit your your full-time job or career to do, but it's a great opportunity to get teaching experience and building your resume for teaching. So again, lab assisting, guest lecturing, adjunct are all excellent ways to build your teaching resume. and ways to kind of get your foot in the door, and ways that current clinicians often, just can build their resume into teaching and get some experience, and are all ways to get involved that you don't have to have that, that full-time or that terminal academic degree. Um, the last kind of role I do want to share, since everyone does have different experiences, is searching for and applying for an actual full-time faculty position. So again, maybe you've had some of these experiences that we've talked about, within teaching, or maybe not, but you really just want to get involved with full-time, full-time faculty role. And there are lots of full-time faculty positions open, because there are a lot of programs in the country for PT and OT, and many have a hard time filling all the positions that they need, for the program. So, accreditation standards do require that faculty have 3 years of clinical experience to be considered for a full-time role. But beyond that, the requirements can vary from university to university. So, for example, some may require that you have a DPT or OTD in some type of specialization as their minimum requirement. Others just may require just the DPT and 3 years of that clinical experience. But just like I shared in the beginning, one thing I want to share is, having a PhD or EDD or terminal academic degree is not an absolute requirement to be considered for a full-time faculty position. Yes, there are accreditation standards, at least on the PT side of things, that 50% of their faculty have to have a terminal degree or be pursuing one. But like I said, I often hear of, well, I shouldn't apply for a full-time, faculty position because I don't have a terminal degree, and I would just want to dispel that myth. Yes, it helps a lot, and it may help you be more competitive for some of these, but it's not an absolute requirement. I got involved and I got hired, um, as clinical faculty with just my DPT, and then worked towards a specialization, which allowed me to get, a promotion within that. And then from there, I had the minimum requirements for where I taught at Nova Southeastern University of the DPT and a specialization. Now, we did hire faculty who did have a specialization as well, but we're working towards it, and then eventually may, have been working towards, a terminal academic degree. But there are many, many faculty. Again, the threshold's only 50% in the, for at least the PT accreditation to have a terminal academic degree. There's many successful and well-seasoned, faculty members who don't have the terminal academic degree, and that's completely fine as well. So just because you've been hired as a faculty member doesn't mean you absolutely have to get it. When I got started, I was like, yeah, I'll keep an open mind and see what I do. And eventually, I really became really interested in teaching and learning, because I was like, well, I know how to be a clinician, but I don't really know how to be a I'm teaching, but I haven't learned about it. And so that was just a, personal motivation for me. And then, I pursued my EDD and got that in educational technology from the University of Florida. But had I, you know, it was my experience in teaching to understand what it was that I was interested in learning more about and researching and those types of things. And it became mutually beneficial, because what I was learning, could apply to my job in teaching, and what my job in teaching, I could apply to my program, and vice versa. So again, don't count yourself out for searching for a full-time faculty role just because you may not have a PhD or EDD. And then also, I really, it doesn't have to go in that order, but I think it's just easier to first land a faculty position and then consider, those terminal academic degrees, because it could be that the university, you get a degree there for a discounted rate, or you may get tuition assistance, or, you know, a lot of times with the, what can be really attractive about a faculty position is the flexibility compared to a full-time clinical role. So my flexibility as a full-time faculty allowed me the time to be able to pursue a terminal academic degree, where if I was a full-time clinician looking to become a faculty member, I wouldn't have time for that terminal academic degree as well. So again, uh, you know, really, when you're considering those full-time academic positions, just look at what the minimum requirements are. And if it's unclear, because they may say we prefer some of the PhD or EDD. If it's unclear, you can always just contact the university, and whomever is listed as the contact person for that. A big question is always, where do I find these jobs? Two places that are very beneficial are to look at the APTA Academy of Education classifieds. And again, this is just coming from my experience in the PT world. OT, I'm sure there's an analogous, type of academy where you can look. And then also the American Council of Academic Physical Therapy, or ACAPT. And that's jobs.acap.org, or you can look, again, the classifieds at the APTA Academy of Education to see faculty positions that are open. Another great place is the Academy of APTA, or APTA Academy of Education's annual conference called ELC, the Education Leadership Conference. There are always universities there who have booths that are advertising faculty positions. There's usually tables with piles and piles of search flyers of faculty. So if you look up that conference and it's something that you're interested in attending, and you're interested, or if you look up that conference and it works for your schedule, I would highly recommend that conference, just to kind of get involved, or just kind of see what the world of academics is within a national conference, and you can make really good connections there as well. So again, that was just, I know, a very brief overview, but I hope that it was helpful to kind of think of, well, what are the different types of roles? How do I at least get started? What does it mean? Am I qualified? And those are the types of questions that was my goal to help answer today. So, helping therapists get involved in teaching or fully transitioning from the clinic into a faculty role is what I do, as a faculty mentor and coach. In partnership with Clinical Connections, we have developed a faculty coaching program to meet the needs of those who want to get involved of teaching, or those who have just started teaching careers and are feeling a bit overwhelmed and lost. Again, most people who get involved as a faculty member or into some type of teaching, you have an expertise, as a doctorally trained clinician, but that doesn't often prepare you for you know, uh, for teaching, and especially for best practices of teaching and learning. So again, that's just we know that there's a very big need of people who either want to look for these jobs and need help or support with that, or how do you build your resume to be considered for these, or you have landed that and you're just feeling a little bit lost in the world of academics, because the world of academics is wonderful but very different than the world of being a clinician. So if the desire to teach has always been there for you and you are ready to take that step, or and you're not sure where to start, you're not sure which path to take or how to consider, or maybe again you've already landed that, but you want that faculty or teaching position, but you want more support, then I encourage you to please reach out. You can DM me, you can drop teach in the comments below, and I'll reach out with details of our program, and I'll be happy to answer just any questions that you may have. Again, I hope that you've learned something new today. Go ahead and drop in the comments your aha moment, or something that really stood out for you, or something that you learned, or something that is going to be helpful for where you are in your career. And I want to thank you for watching from wherever you're watching from. If you have any questions about anything that I talked about today, please feel free to message me or leave your questions in the comments. So again, thank you for your time, and I look forward to hearing from you.